Hi, this is Dr. Sal from Gut Savior. Wanted to talk to you about Crohn's disease and diet. So yes, we have marvelous medications available, the biologics that treat Crohn's disease now and keep it under control. So far, we don't have cure. So the treatment is not curative, but it can quiet it down to the level of remission. So yes, there are great biologics available out there, medications, but the question is again, diet. What role does diet have in Crohn's disease patients, which is, as you know, is part of the inflammatory bowel disease spectrum. And on one hand, you have ulcerative colitis, and on the other hand, you have Crohn's disease. And I have discussed before, Crohn's disease can occur anywhere in the GI tract from mouth all the way down to the anus. And ulcerative colitis, as the name implies, is an ulcerative condition in the colon. It does not go anywhere else in the GI tract except in the colon. But there could be extra intestinal manifestations where different things could be seen along with like skin conditions and eye conditions, etc. So Crohn's disease and the diet, there is a diet called Crohn's disease exclusion diet. So this is a very intense first 6 weeks of severe restrictions, and then it's slowly, the second 6 weeks is the liberalization, and the last 6 weeks is the maintenance phase of this diet. So it has 3 phases. The first one is very restrictive, and in Crohn's the restriction is highly ultra processed food, animal fat, red meat, processed meat, gluten, and dairy. They are restricted, and emulsifiers are also restricted. So this is the first 6 weeks, and then after that slowly some diet is liberalized, and then finally the last few weeks is where there is maintenance, where you find the food that is affecting you the most, you restrict them for longer period of time. Other than that, Mediterranean diet has been found in multiple studies to show it stops the flare-ups, it reduces the degree of severity of this Crohn's disease, and leads to better quality of life in general. So because with low sugar, low salt, lean meat, fresh vegetables, and fruits. What affects Crohn's disease most and is raw vegetables that can create flare-ups, and the fruits with the peel, and also lactose, because in flare-ups especially there is lactose intolerance in Crohn's disease patients. So avoiding lactose in those situations is very helpful. Now, what other things have been found to help? It has been shown that zinc deficiency leads to more flare-ups, hospitalizations, and severity of the disease. So have your doctor check your zinc level and make sure that you have zinc supplements to make sure you don't suffer the flare-ups. Other than that, studies have shown that babies or infants at 1 year of age, if they are given good fish diet, then that itself prevents Crohn's disease in the future. So that's a very important point, that when you're introducing vegetables and other food items, introducing fish at age 1 will certainly help the children. As you know, that Crohn's and colitis, and these are multifactorial. It's not one single cause that causes it. So you have genetic contribution, you have environmental contribution, you have your microbiome changes, you have your gut permeability changes. So all these affect, and the diet, of course, we have to be careful how we take it in general. So our diet definitely affects it. Certain things like oleic acid, they have been found to help with ulcerative colitis, but not necessarily with the Crohn's disease itself. So that is my advice on Crohn's disease and the dietary aspect of it. We'll talk more. Thank you for joining. This is Dr. Sal from Gut Savior.